Hi there, welcome to Vital Sphere. Today, we will unpack the hype around magnesium. This will change your perspective about magnesium. What is magnesium? Magnesium is a vital mineral that plays a crucial role in numerous biological functions, such as muscle and nerve function, blood glucose control, and bone health. It is the fourth most abundant mineral in the human body and is found in a variety of foods, including leafy green vegetables, nuts, seeds, and whole grains. Importance of magnesium. Magnesium is involved in over 300 enzymatic reactions and contributes to the synthesis of protein, muscle contraction, and DNA replication. It also helps maintain normal nerve and muscle function, regulates blood pressure, and supports a healthy immune system. 2. Sources of magnesium. Magnesium is naturally found in many foods. It is important to ensure an adequate intake through diet or supplements. Dietary sources: leafy green vegetables, spinach, kale, Swiss chard, nuts and seeds, almonds, sunflower seeds, pumpkin seeds. Whole grains: brown rice, quinoa, oatmeal, legumes, beans, lentils, chickpeas. Fruits: bananas, avocados, figs, dairy, milk, yogurt, fish, salmon, mackerel. 3. Magnesium deficiency. A magnesium deficiency can lead to a range of health issues. It is essential for people to be aware of the signs and symptoms of low magnesium levels. Causes of deficiency: inadequate dietary intake, poor absorption due to digestive disorders like Crohn's disease or celiac disease, excessive alcohol consumption, certain medications, such as diuretics and antibiotics. Symptoms of deficiency: muscle cramps or spasms, fatigue or weakness, nausea or vomiting, abnormal heart rhythms, mental health issues like depression or anxiety. 4. Health benefits of magnesium. Magnesium plays a fundamental role in overall health, affecting multiple bodily systems. 4.1 Cardiovascular health. Magnesium helps regulate heart rhythm and blood pressure. It can help prevent arrhythmias, irregular heartbeats, and reduce the risk of hypertension, high blood pressure. 4.2 Bone health. Magnesium is essential for bone formation and works alongside calcium and vitamin D to maintain bone strength and density. It can also help prevent osteoporosis. 4.3 Muscle function. Magnesium is important for muscle relaxation and contraction. It is used in the prevention and treatment of cramps and spasms, particularly in athletes and pregnant women. 4.4 Nervous system and mental health. Magnesium has been shown to have a calming effect on the nervous system, and it can reduce symptoms of anxiety, depression, and insomnia. It helps regulate neurotransmitters, which send messages throughout the brain and nervous system. 4.5 Blood sugar control. Magnesium helps regulate blood sugar levels and is crucial in preventing and managing type 2 diabetes. It improves insulin sensitivity and plays a role in glucose metabolism. 5. Magnesium supplementation. While it's preferable to get magnesium from food sources, supplements are an option for individuals with dietary restrictions or magnesium deficiencies. Types of magnesium supplements. Magnesium citrate, a common form of magnesium that is highly bioavailable and often used for digestive health. Magnesium glycinate, known for its calming effects, it's less likely to cause gastrointestinal discomfort. Magnesium oxide, a less expensive form but may have a lower absorption rate. Magnesium chloride, often used topically in the form of oils or lotions. Magnesium threonate, known for its potential benefits to cognitive function. Recommended dosage. The recommended daily intake of magnesium varies by age, gender, and health status, but the average adult typically needs between 300 to 400 milligrams per day. 6. Magnesium in disease prevention. Research suggests that magnesium plays a role in preventing various chronic diseases. 6.1 Cardiovascular disease. Adequate magnesium intake has been associated with a reduced risk of heart disease, including stroke and high blood pressure. Magnesium helps maintain healthy blood vessel function and regulate blood pressure. 6.2 Diabetes. Magnesium helps regulate blood sugar levels and may lower the risk of developing type 2 diabetes by improving insulin sensitivity. 6.3 Migraine relief. Magnesium deficiency has been linked to migraines. Supplementing magnesium may reduce the frequency and severity of migraines. 6.4 Osteoporosis. Magnesium is a crucial mineral for bone health. Adequate intake can help prevent osteoporosis and improve bone density. 7. Magnesium and mental health. Magnesium has a direct impact on mental well-being and cognitive functions. It is essential for proper brain function and emotional regulation, stress and anxiety. Magnesium has calming properties and may reduce symptoms of stress and anxiety. It helps regulate cortisol levels, the body's stress hormone. Depression. Several studies have found that magnesium plays a role in reducing the symptoms of depression. It has been shown to have antidepressant effects, particularly in individuals with low magnesium levels. Sleep disorders. Magnesium helps regulate the production of melatonin, a hormone that controls sleep-wake cycles. It can help improve sleep quality and duration, especially in people with insomnia. 8. Magnesium toxicity. Though magnesium toxicity is rare, it can occur, especially when individuals take excessive magnesium supplements. Symptoms of toxicity: diarrhea, nausea, and vomiting, low blood pressure, irregular heartbeat, respiratory issues. Toxicity typically occurs when intake exceeds 5,000 milligrams per day, but it is much less likely to happen through dietary magnesium. 9. Magnesium for athletes. Athletes have higher magnesium needs due to the mineral's role in muscle function and recovery. Magnesium helps prevent cramps, reduces muscle soreness, and supports energy production during exercise. Magnesium and exercise performance. Magnesium helps regulate muscle contraction and relaxation. It's particularly important for endurance athletes, as it can help reduce fatigue and improve performance. 10. Conclusion. Magnesium is a crucial nutrient with wide-reaching benefits for overall health, including cardiovascular, muscular, and mental well-being. It is important to maintain a balanced diet rich in magnesium and consider supplementation when necessary. The many health benefits of magnesium make it an essential part of a healthy lifestyle, helping prevent chronic diseases and supporting daily bodily functions. A professional athlete's recovery from cramps. John's story. John, a professional marathon runner, had struggled with severe muscle cramps during long training sessions and races. Despite following a strict training regimen and maintaining a balanced diet, he found himself unable to prevent cramping, especially in the latter stages of his runs. After several rounds of physiotherapy and even trying different electrolyte supplements, his condition didn't improve significantly. John's doctor recommended increasing his magnesium intake, suggesting magnesium-rich foods like spinach, almonds, and bananas, as well as magnesium supplements. Within a few weeks, John noticed a significant reduction in muscle cramps. He was also sleeping better and experiencing less fatigue during his runs. His magnesium levels were tested and found to be low, contributing to his muscle cramps and exhaustion. After regularly incorporating magnesium supplements into his routine, John reported fewer issues with cramping and felt more energized during his races. This case highlights how magnesium plays an essential role in muscle function and athletic performance, particularly for endurance athletes. 2. Story: Magnesium and migraines. Sarah's story. Sarah, a 32-year-old woman, had been suffering from chronic migraines for over 10 years. She had tried various treatments, including prescription medications and over-the-counter pain relievers, but none provided long-lasting relief. Her migraines were often triggered by stress, certain foods, and even changes in weather. After reading about the potential benefits of magnesium for migraine prevention, Sarah decided to try magnesium supplements. Her doctor had mentioned that magnesium deficiency is linked to migraines, and research suggests that magnesium may help prevent the frequency and severity of headaches. Within a month of taking magnesium citrate supplements, Sarah noticed a decrease in the frequency of her migraines. She also experienced less severe headaches when they did occur. Over time, Sarah found that her magnesium supplement routine helped to stabilize her migraine episodes. Her experience is a powerful example of how magnesium supplementation can provide relief from chronic health conditions like migraines, especially in individuals with a deficiency. 3. Case study: a senior's journey to overcoming magnesium deficiency. Mrs. Thompson's story. Mrs. Thompson, a 68-year-old retiree, had been feeling unusually fatigued and weak for several months. She had difficulty climbing stairs, and her muscles seemed to ache even after minimal activity. Her blood pressure was also higher than usual, and her mood was often down. After visiting her doctor, blood tests revealed that her magnesium levels were critically low. Her doctor explained that magnesium deficiency is common among older adults, especially those who may not get enough magnesium-rich foods in their diet. Mrs. Thompson was prescribed magnesium supplements and advised to increase her intake of magnesium-rich foods like leafy greens, nuts, and whole grains. Over the course of a few months, Mrs. Thompson's energy levels began to improve. Her muscle strength returned, and she no longer felt as fatigued. Her blood pressure also stabilized, and she felt more emotionally balanced. Mrs. Thompson's story is an example of how magnesium deficiency can impact overall well-being, particularly in older adults, and how proper supplementation can help restore health and energy. 4. Real-world story: magnesium's impact on anxiety and sleep. David's story. David, a 40-year-old executive, had been dealing with high levels of stress due to his demanding job. He often found it difficult to unwind after work, leading to problems with anxiety and insomnia. Despite trying meditation, yoga, and various relaxation techniques, he struggled to calm his mind at night, leading to restless sleep and heightened anxiety during the day. On the advice of a friend, David decided to try magnesium supplementation, as he had read that magnesium helps with anxiety and sleep. He started taking magnesium glycinate before bedtime, a form known for its calming effects. Within a few weeks, David noticed a significant reduction in his anxiety levels. He also started to sleep more soundly and wake up feeling more refreshed. David's improvement was due in part to magnesium's ability to regulate neurotransmitters involved in stress and sleep, such as GABA. His story serves as an example of how magnesium can play an essential role in managing mental health conditions like anxiety and insomnia. 5. Story: magnesium's role in pregnancy. Maria's story. Maria, a first-time pregnant woman, began experiencing frequent leg cramps, especially at night, during her second trimester. The cramps were so severe that they woke her up several times a night. Maria's doctor explained that leg cramps during pregnancy are common, often due to hormonal changes and a potential magnesium deficiency. To address this, Maria's doctor recommended she increase her magnesium intake. She added magnesium-rich foods to her diet and began taking magnesium supplements. Within a few weeks, the leg cramps diminished, and Maria was able to sleep more soundly. She was also relieved to learn that magnesium is essential for both her health and the development of her baby, helping with muscle function, nerve health, and the development of the baby's bones. Maria's story highlights the importance of magnesium during pregnancy, especially in preventing common discomforts like leg cramps. It also emphasizes the role magnesium plays in supporting the health of both mother and child. 6. Magnesium and heart health. Tom's story. Tom, a 58-year-old man, had been dealing with high blood pressure for several years. Despite taking medication, his blood pressure remained elevated, and his doctor expressed concern about the risk of cardiovascular disease. Tom also experienced occasional arrhythmias, which further worried him about his heart health. Tom's doctor suggested increasing his intake of magnesium-rich foods, as magnesium is known to help regulate blood pressure and support heart function. Tom followed this advice, eating more leafy greens, nuts, seeds, and whole grains, and also started taking magnesium supplements. After several months, Tom's blood pressure dropped to a healthier range, and he reported fewer episodes of arrhythmia. His doctor confirmed that his magnesium levels were now within the normal range and attributed the improvements to the dietary changes. Tom's story highlights how magnesium can be an essential tool in managing high blood pressure and supporting heart health, particularly in individuals with a history of cardiovascular concerns. These true stories serve as real-life examples of how magnesium plays a role in improving health, preventing deficiencies, and alleviating symptoms of various conditions. Would you like to explore any of these stories in more detail or include more specific case studies? Pro and cons of magnesium. Pros of magnesium. 1. Supports muscle function. Magnesium plays a vital role in muscle contraction and relaxation. It helps to prevent cramps, especially in athletes or individuals who experience muscle spasms due to magnesium deficiency. This is why magnesium supplements are often recommended for athletes and people prone to leg cramps or muscle soreness. 2. Promotes heart health. Magnesium helps regulate blood pressure and supports proper heart function. It has been shown to reduce the risk of hypertension, high blood pressure, and can even help prevent arrhythmias, irregular heartbeats. People with magnesium deficiency are at a higher risk for cardiovascular diseases, making it essential for maintaining heart health. 3. Improves bone health. Magnesium works in synergy with calcium and vitamin D to help maintain strong, healthy bones. Adequate magnesium intake is associated with increased bone mineral density and a lower risk of osteoporosis. It also plays a role in bone formation and the regulation of calcium levels within the bones. 4. Mental health benefits. Magnesium has been shown to have a calming effect on the nervous system, helping to alleviate symptoms of anxiety, depression, and stress. It is often recommended as part of a holistic approach to managing mental health issues. And several studies have found magnesium to be effective in improving mood and reducing anxiety. 5. Improves sleep quality. Magnesium helps regulate the production of melatonin, the hormone responsible for controlling the sleep-wake cycle. Supplementing with magnesium can improve sleep quality, especially for people suffering from insomnia, by promoting relaxation and reducing muscle tension. 6. Assists in blood sugar regulation. Magnesium plays an important role in regulating blood sugar levels. It helps improve insulin sensitivity, making it a helpful supplement for individuals with type 2 diabetes or those at risk for the condition. Adequate magnesium intake has been linked to a reduced risk of developing diabetes. 7. Anti-inflammatory properties. Magnesium has natural anti-inflammatory properties. It can help reduce systemic inflammation, which is a contributing factor in various chronic diseases such as arthritis, cardiovascular disease, and diabetes. Cons of magnesium. 1. Potential for toxicity. While magnesium toxicity is rare, it can occur, especially when people take excessive magnesium supplements or consume very high doses. Symptoms of magnesium toxicity include diarrhea, nausea, vomiting, low blood pressure, irregular heart rhythms, and even respiratory issues. It's particularly important to avoid excessive intake of magnesium supplements, especially for individuals with kidney problems. 2. Gastrointestinal side effects. Magnesium supplements, especially in forms like magnesium citrate or magnesium oxide, can sometimes cause gastrointestinal discomfort, such as diarrhea, bloating, or stomach cramps. People who are sensitive to magnesium may experience these side effects, making it important to monitor your dosage and form of magnesium. 3. Interaction with certain medications. Magnesium supplements can interact with certain medications, such as antibiotics, for example, tetracyclines, diuretics, and medications for osteoporosis. These interactions can reduce the effectiveness of the medications or cause undesirable side effects. It is always recommended to consult a healthcare provider before starting magnesium supplementation, particularly for individuals on prescription medication. 4. Kidney disease risk. People with kidney disease need to be cautious when taking magnesium supplements. Since magnesium is excreted through the kidneys, individuals with kidney impairment may have difficulty clearing magnesium from their system, potentially leading to magnesium buildup and toxicity. 5. Over-reliance on supplements. While magnesium supplementation can be beneficial, it is important not to rely solely on supplements to meet magnesium needs. Relying too heavily on magnesium supplements rather than a balanced diet can lead to nutrient imbalances and may overlook the broader context of overall nutritional health. 6. Possible interference with absorption of other minerals. High doses of magnesium can interfere with the absorption of other important minerals, such as calcium and phosphorus. If magnesium supplements are taken in excess, they may disrupt the balance of these minerals in the body, potentially leading to deficiencies or complications. 7. Not suitable for everyone. Magnesium supplements might not be suitable for certain individuals, including those with certain medical conditions like severe heart disease, kidney disease, or gastrointestinal disorders that affect magnesium absorption. It's important to seek medical advice before starting supplementation, particularly if you have any pre-existing conditions. Conclusion: weighing the pros and cons. Magnesium is an essential nutrient with a wide range of health benefits. It plays a crucial role in muscle function, heart health, mental health, bone density, and more. However, like any supplement, it is important to use magnesium wisely. Potential side effects, such as gastrointestinal discomfort or toxicity, can occur if taken in excess. It's best to get magnesium from food sources, and supplementation should be considered when dietary intake is insufficient or when a deficiency is diagnosed. By understanding the pros and cons of magnesium, you can make informed decisions about how to incorporate it into your health routine, whether through dietary changes or supplements. If you have any health concerns or conditions, always consult with a healthcare provider before making changes to your magnesium intake. Let's dive deeper into the pros and cons of magnesium for specific groups, such as athletes and pregnant women. To provide a more tailored understanding of how magnesium can benefit these individuals and any potential risks they should consider. Magnesium for athletes. Pros for athletes. Improved muscle function and recovery. Magnesium is essential for muscle contraction and relaxation, which is why athletes particularly benefit from it. During intense physical activity, magnesium helps muscles function properly, reducing the risk of cramps and spasms. Additionally, it aids in muscle recovery post-exercise by replenishing lost electrolytes and reducing soreness. Many athletes use magnesium to reduce the occurrence of leg cramps and muscle fatigue, especially after long endurance events or strength training sessions. Enhanced performance. Magnesium supports energy production by helping in the synthesis of ATP, adenosine triphosphate, the body's primary energy molecule. Magnesium also plays a key role in the proper functioning of enzymes involved in metabolism, which helps maintain sustained physical performance. Athletes who are magnesium replete may experience less fatigue, more stamina, and quicker recovery. Prevention of magnesium deficiency. During high-intensity exercise, magnesium is lost through sweat, and athletes who train rigorously are at higher risk of magnesium deficiency. This can lead to symptoms like cramping, fatigue, and muscle weakness, all of which can affect performance. By ensuring sufficient magnesium intake, athletes can prevent deficiencies that impair performance. Supports bone health for high-impact sports. Athletes involved in high-impact sports, such as basketball, running, or weightlifting, place significant stress on their bones. Magnesium, in combination with calcium and vitamin D, plays a crucial role in maintaining bone strength and reducing the risk of fractures or injuries, especially in individuals who undergo repetitive stress. Reduction of stress and anxiety. Many athletes face high levels of stress before and after competitions. Magnesium helps regulate cortisol, the stress hormone, thereby reducing anxiety and promoting a sense of calm. Athletes may find magnesium supplements beneficial during high-stress events, as it can improve focus and relaxation. Cons for athletes. Gastrointestinal discomfort. Some athletes may experience gastrointestinal issues, such as diarrhea or bloating, when taking magnesium supplements. This is especially true for forms like magnesium citrate, which can have a laxative effect. Athletes need to find the right form and dose of magnesium to avoid digestive issues while still reaping the benefits. Risk of oversupplementation. In the pursuit of optimal performance, athletes might be tempted to take high doses of magnesium supplements. While magnesium toxicity is rare, excessive intake, especially when combined with other electrolytes like potassium and calcium, can cause side effects such as nausea, diarrhea, or irregular heartbeats. It's crucial for athletes to work with a healthcare professional to determine the right amount of magnesium for their needs. Potential interactions with medications. Some athletes may take medications for chronic conditions, for example asthma, high blood pressure, or allergies. Magnesium can interact with certain medications, such as diuretics or antibiotics, which can reduce the efficacy of both the medication and the supplement. Athletes need to be mindful of these interactions and consult a doctor before taking magnesium supplements. Magnesium for pregnant women. Pros for pregnant women. Prevention of leg cramps. Leg cramps during pregnancy are a common complaint, especially in the second and third trimesters. Magnesium helps to reduce these cramps by promoting muscle relaxation. Pregnant women who experience nighttime leg cramps may benefit from magnesium-rich foods or supplements, as it helps alleviate the severity and frequency of these cramps. Support for healthy pregnancy and baby development. Magnesium plays an important role in the development of the fetus. It supports the growth of bones and teeth, and it helps in the formation of the baby's nervous system. Magnesium is also involved in regulating blood pressure, which can be crucial in preventing pregnancy-related hypertension or preeclampsia, a condition that causes high blood pressure and organ damage during pregnancy. Reduces stress and anxiety. Pregnancy can bring emotional and physical stress, and magnesium is known for its calming effects. It helps regulate the body's stress response by controlling cortisol levels, reducing anxiety, and improving overall mood. Many pregnant women report feeling more relaxed and better able to manage stress after increasing their magnesium intake. Helps with sleep issues. Many pregnant women struggle with sleep disturbances, especially in the later stages of pregnancy. Magnesium aids in regulating the production of melatonin, the hormone that controls sleep cycles. It also relaxes the muscles and nervous system, contributing to better quality sleep and fewer interruptions during the night. Blood sugar regulation. Magnesium helps regulate blood sugar levels, which can be beneficial in preventing gestational diabetes, a type of diabetes that can develop during pregnancy. Magnesium's role in insulin sensitivity can reduce the risk of developing this condition, supporting both maternal and fetal health. Cons for pregnant women. Risk of oversupplementation. While magnesium is safe in recommended doses, excessive magnesium intake during pregnancy can lead to side effects such as diarrhea, low blood pressure, or abdominal discomfort. Pregnant women should avoid taking high doses of magnesium supplements unless prescribed by a healthcare provider to avoid toxicity or oversupplementation. Potential for gastrointestinal discomfort. Magnesium supplements, particularly in forms like magnesium citrate, may cause gastrointestinal discomfort, such as diarrhea or bloating. Since pregnancy can already cause digestive issues like constipation, this can be an additional challenge. Pregnant women should choose magnesium forms that are gentler on the stomach, like magnesium glycinate, to minimize side effects. Kidney function considerations. Pregnant women with pre-existing kidney conditions should exercise caution when taking magnesium supplements. Since magnesium is excreted through the kidneys, impaired kidney function can make it difficult to clear magnesium from the body, potentially leading to magnesium toxicity. Kidney function should be assessed before starting magnesium supplementation. Potential interactions with medications. Pregnant women who are on medications for chronic conditions like hypertension, diabetes, or depression need to consult their healthcare provider before starting magnesium supplements. Magnesium may interact with certain medications, potentially reducing their effectiveness or causing adverse reactions. Conclusion for athletes and pregnant women. Magnesium offers a wide array of benefits for both athletes and pregnant women, but like any supplement, it needs to be used with care. For athletes, magnesium can improve performance, support muscle recovery, and help prevent cramping and fatigue. However, the risk of gastrointestinal discomfort and oversupplementation should be considered. For pregnant women, magnesium is crucial for reducing cramps, supporting fetal development, improving sleep, and maintaining healthy blood sugar levels. However, pregnant women need to be cautious about taking excessive amounts and should consult with a healthcare provider before supplementing. Magnesium is generally safe and beneficial for both groups when used appropriately, but like with all health interventions, individualized care and professional guidance are key to maximizing its benefits and avoiding any potential drawbacks. Let's dive deeper into how magnesium specifically works in various conditions for both athletes and pregnant women. We'll explore how magnesium impacts these groups in the context of their health challenges and how it may be used for better outcomes. Magnesium for athletes in specific conditions. 1. Magnesium for athletic performance and endurance. Athletes in endurance sports, such as long-distance running, cycling, or swimming, place significant strain on their muscles and energy systems. Magnesium plays a crucial role in energy production by facilitating the synthesis of ATP, which is the primary energy molecule in cells. As athletes burn through energy stores during exercise, magnesium helps maintain muscle function, reduce the buildup of lactic acid, and prevent cramps or spasms. How magnesium helps reduces fatigue. By supporting the energy production pathways, magnesium helps athletes maintain energy levels and endurance throughout prolonged physical exertion. Prevents cramps. Magnesium supports muscle relaxation, which is especially useful in preventing and alleviating muscle cramps that commonly occur during or after intense exercise. Improves recovery. Post-exercise, magnesium helps with the repair of muscle fibers and replenishes electrolytes lost during exercise. This aids in faster recovery and reduced muscle soreness. 2. Magnesium for strength training. Strength training can lead to muscle strain and fatigue due to the high intensity of the exercises. Magnesium plays a role in maintaining proper muscle function by regulating calcium and potassium levels in muscle cells, which are necessary for contraction and relaxation. How magnesium helps supports muscle contraction. Magnesium helps regulate the contraction and relaxation of muscles, which is vital during strength training, reducing the risk of injury or strain. Reduces risk of overtraining. Magnesium supplementation can prevent the effects of overtraining syndrome by supporting muscle recovery and reducing the chances of fatigue or burnout. Promotes muscle protein synthesis. Magnesium helps in protein synthesis, which is critical for muscle growth and repair following strength training. 3. Magnesium and dehydration. Athletes lose magnesium through sweat, particularly in high-intensity exercise or hot climates. Low magnesium levels can lead to dehydration and electrolyte imbalances, which impair performance and increase the risk of cramping. How magnesium helps. Electrolyte balance. Magnesium helps regulate electrolyte balance, especially in conjunction with sodium, potassium, and calcium, helping athletes stay hydrated and maintain muscle function. Prevents dehydration. By regulating hydration levels and preventing excessive water loss, magnesium helps reduce the risk of heat exhaustion and dehydration in athletes, especially those in endurance sports. 4. Magnesium for injury recovery. Magnesium supports the healing process by promoting bone health and muscle repair, making it valuable for athletes recovering from injury. Whether dealing with a sprain, fracture, or strain, magnesium plays an essential role in reducing inflammation and speeding up tissue repair. How magnesium helps. Anti-inflammatory effects. Magnesium has natural anti-inflammatory properties that help reduce swelling and inflammation in the affected area, promoting faster healing. Supports bone health. Magnesium is crucial for bone health, which is important for athletes recovering from bone injuries or fractures. Potential drawbacks for athletes. While magnesium offers significant benefits, Some athletes may experience digestive issues from magnesium supplements, especially if taken in large doses. Diarrhea or bloating can occur, which may interfere with training or performance. Finding the right form of magnesium, such as magnesium glycinate or magnesium malate that is gentler on the stomach, is key to avoiding these side effects. Magnesium for pregnant women in specific conditions. 1. Magnesium for pregnancy-related leg cramps. Leg cramps during pregnancy are common, especially during the second and third trimesters, and they can cause significant discomfort at night. These cramps are often due to hormonal changes, increased blood volume, and a growing uterus that puts pressure on certain muscles and nerves. How magnesium helps. Reduces leg cramps. Magnesium plays a role in muscle relaxation and helps alleviate the frequency and severity of leg cramps. It works by relaxing the muscles and supporting proper nerve function. Improves sleep. By reducing nighttime leg cramps, magnesium contributes to better sleep quality, which is often disrupted during pregnancy due to discomfort and restless legs. 2. Magnesium for preeclampsia prevention. Preeclampsia is a pregnancy complication characterized by high blood pressure and organ damage, typically after the 20th week of pregnancy. Magnesium sulfate is often used in medical settings to prevent seizures in women with preeclampsia. How magnesium helps. Regulates blood pressure. Magnesium helps regulate blood pressure by dilating blood vessels and reducing vascular resistance, which can be beneficial for women with pregnancy-related hypertension or at risk of preeclampsia. Prevents seizures. In severe cases of preeclampsia, magnesium sulfate is used intravenously in hospitals to reduce the risk of seizures, a common complication of preeclampsia. It has neuroprotective effects that help protect both the mother and the baby. 3. Magnesium for constipation during pregnancy. Pregnant women often experience constipation due to hormonal changes, slower digestion, and changes in diet. Magnesium can act as a natural laxative by drawing water into the intestines and relaxing the smooth muscles of the gastrointestinal tract. How magnesium helps. Relieves constipation. Magnesium helps relieve constipation by stimulating bowel movements and softening stool, making it easier to pass. Improves digestive health. It supports regular bowel function, reducing bloating and discomfort associated with pregnancy-related constipation. 4. Magnesium for mood and stress management. Pregnancy can bring about emotional changes, including anxiety, depression, and mood swings. Magnesium plays a role in regulating the production of neurotransmitters like serotonin and dopamine, which are involved in mood regulation. How magnesium helps. Reduces anxiety. Magnesium has a calming effect on the nervous system and can help reduce feelings of anxiety or stress, which are common during pregnancy due to hormonal shifts and lifestyle changes. Supports mood stability. Magnesium's ability to balance neurotransmitters may help prevent mood swings and reduce the risk of developing pregnancy-related depression or anxiety. 5. Magnesium for insomnia during pregnancy. Many pregnant women experience difficulty sleeping due to physical discomfort, frequent urination, and anxiety. Magnesium is known to help regulate the sleep-wake cycle by influencing melatonin levels, the hormone that governs sleep patterns. How magnesium helps. Promotes relaxation. Magnesium relaxes the muscles and nervous system, making it easier for pregnant women to fall asleep and stay asleep throughout the night. Improves sleep quality. Magnesium supplementation before bed can lead to more restful and uninterrupted sleep, which is important for the mother's overall health and well-being. Potential drawbacks for pregnant women. Risk of oversupplementation. Excessive magnesium intake during pregnancy can lead to side effects such as diarrhea, low blood pressure, and gastrointestinal discomfort. Pregnant women should follow recommended dosage guidelines and consult a healthcare provider before starting magnesium supplements. Interaction with medications. Pregnant women who are on other medications, such as those for high blood pressure or gestational diabetes, should consult with their doctor before taking magnesium supplements, as there may be potential interactions. Conclusion. Magnesium offers incredible benefits for both athletes and pregnant women, but it's important to approach supplementation with care. Athletes can use magnesium to enhance performance, reduce cramping, and speed up recovery, while pregnant women can benefit from magnesium to reduce leg cramps, improve sleep, and support healthy pregnancy outcomes. However, both groups should be mindful of the potential side effects, such as gastrointestinal discomfort or oversupplementation, and consult with a healthcare provider to tailor magnesium intake to their specific needs. Golden tips for maximizing magnesium benefits. Before wrapping up, here are some golden tips and expert advice to help your audience make the most out of magnesium. 1. Prioritize food sources first. While supplements can be helpful, it's always best to get magnesium from natural food sources whenever possible. Some of the best magnesium-rich foods include leafy green spinach, kale, nuts and seeds almonds, cashews, pumpkin seeds whole grains quinoa, brown rice legumes black beans, lentils, chickpeas dark chocolate 85 or higher bananas and avocados. 2. Choose the right magnesium supplement. Not all magnesium supplements are created equal. Different forms serve different purposes. For muscle cramps and recovery, magnesium citrate or magnesium malate for sleep and relaxation, magnesium glycinate for digestion and constipation relief, magnesium oxide for general health and absorption, magnesium chloride. Avoid cheap, low-quality magnesium supplements, as they may contain fillers and be poorly absorbed by the body. 3. Timing matters for better sleep. Take magnesium 30–60 minutes before bedtime. For energy and performance, take it in the morning or before a workout. For digestion, take it with meals to improve absorption and gut health. For balance with other minerals, magnesium works best when balanced with calcium, potassium, and vitamin D. Magnesium to calcium ratio. Aim for 1:1 or 2:1 magnesium, calcium for best absorption. Vitamin D boosts absorption. Get some sunlight or take vitamin D with magnesium for optimal results. 5. Stay hydrated. Magnesium plays a crucial role in hydration and electrolyte balance. If you're taking magnesium supplements, drink plenty of water to avoid dehydration or digestive discomfort. 6. Listen to your body. Too much magnesium? Signs of excess magnesium intake include diarrhea, nausea, and low blood pressure. If you experience these symptoms, reduce your dose immediately. Magnesium deficiency signs. If you often feel fatigued, have frequent muscle cramps, headaches, or trouble sleeping, you may need more magnesium in your diet. 7. Consult a healthcare professional. If you have chronic health conditions like kidney disease, heart issues, or pregnancy-related concerns, always consult a doctor before starting any magnesium supplement. Final thought: magnesium, the miracle mineral. Magnesium is a game changer for energy, stress relief, muscle recovery, and overall health. Whether you're an athlete, a pregnant woman, or just someone looking to improve well-being, magnesium is essential. Make magnesium a daily habit through food or supplementation, and you'll feel the difference in your energy, sleep, and overall health. What's your experience with magnesium? Let us know in the comments. Like and share this post to help others discover the power of magnesium. Thank you for watching. See you at our next video at Vital Sphere. Stay healthy.